Imagine turning 50 years of age only to discover you have a 55-year-old heart and a 46-year-old brain. A landmark study out of Stanford Medicine proved that our organs age at entirely different rates, and researchers have developed a blood test to track, and even treat, these distinct biological timelines. We usually measure our health with a single number, our chronological age. This assumes that every system inside us is moving at that exact same speed. Standard medicine generally waits for things to break. We rely on standard biomarkers, like testing your eGFR to estimate kidney function, and we only diagnose a problem once those numbers drop into an abnormal range. The problem is, by the time clinical symptoms of heart failure or Alzheimer's actually show up, the localized tissue damage is already severe. Tracking our overall chronological age creates an illusion of health. It blinds us to the silent, invisible deterioration happening inside our individual organs. The Stanford researchers started with a hypothesis. As organs age, they shed highly specific proteins into the bloodstream. Think of it like a car engine shedding microscopic metal shavings into its oil over time. To test this, they analyzed the blood plasma of over 5,600 adults, scanning for nearly 5,000 different proteins. They successfully isolated 856 specific organ-enriched proteins. These molecules act as direct biological readouts for 11 major organ systems, all flowing right into a standard blood draw. Using machine learning, they developed a core metric called the age gap. They calculate the biological age of a specific organ and then subtract the patient's chronological age from it. The rule here is simple. If the equation yields a positive number, that specific organ is aging faster than you are. It is experiencing accelerated biological decline. Human blood carries a continuous stream of data from every major system. By measuring these proteins, we can finally see the precise biological age of our internal hardware. This data allowed researchers to categorize people into 3 distinct aging profiles, called age types, proving that human aging is shockingly uneven. This chart shows the distribution of those profiles. The majority block represents the normal ager. For about 77% of the population, their overall biological organ age tracks pretty closely with their chronological age. But then we look at the single organ ager segment. Nearly 1 in 5 healthy adults over 50 have extreme accelerated aging isolated entirely to one single organ. Finally, we have this tiny sliver, the multi-organ ager. These individuals have extreme aging occurring in multiple systems at once, carrying a severe consequence, a 6.5 times higher risk of mortality. When we zoom in on the danger zones for specific organs, the data is striking. Accelerated heart aging, tracked through proteins like NPPB, drives a 250% increased risk of heart failure. An accelerated age gap in the brain and vascular system serves as a potent predictor for cognitive decline and Alzheimer's disease, identifying the progression of the disease long before clinical memory loss. Meanwhile, accelerated aging in the kidneys proved to be the strongest predictor for impending metabolic diseases. Identifying these age types provides a specific forecast for each organ's future, allowing clinicians to move past generalized health assessments. This proteomic data isn't meant to be a fatalistic doomsday clock. It is an early warning system designed specifically for targeted intervention. The Stanford researchers have already founded a company called Teal-Omics to bring this out of the lab, commercializing a precise blood test for organ age that you can actually take. By testing for these proteins, you can connect the science to immediate action. The study found that having hypertension and diabetes ages your kidneys by over a year. Managing your blood pressure today directly protects that specific organ tomorrow. Similarly, if your results show accelerated artery aging, you know that system is vulnerable to Alzheimer's, giving you a clear directive to adopt cardiovascular exercise and a Mediterranean diet immediately. To recap, your body does not age uniformly. Your 11 major organs operate on completely independent biological timelines. Tracking the specific proteins in your plasma detects subclinical organ deterioration years before symptoms ever arise, paving the way for hyper-targeted lifestyle interventions. Aging is no longer a mysterious, unstoppable wave. It is a measurable biological map, offering a window of time to intervene before the first symptom appears.